क्या किया? Hey mommies, welcome to our show. We'll wait for our expert to join in.
Hi,
Hi ma'am, how are you doing? A very warm welcome.
I'm fine. How are you?
Good, very good ma'am.
Great to see you here.
Same here ma'am. So let's start with our evening today. It's already 5:01. Hey mommies, a very warm welcome. Welcome to our show. Thank you so much for all the feedbacks and the comments that you all have shared, and you keep motivating us to come back with new topics and with new experts. So for today, as we all know, for a woman, we always teach our young ones that education is the first step of self-care. Do you all think that we follow that? The moment we become mothers, we become so busy around the baby, the family, and everything that we tend to forget ourselves. Heavy bleeding, sleepless nights, hot flashes, and there are so many such symptoms that we face in our day to day life once we are near to 40. And that becomes a general uh, it becomes a general thing for us. That is something we are facing every single day, and we do not bother about talking about that topic or to take expert help on that thing. So do you all think, is it normal? Do you all think, is there any side effect for that thing? Have you ever thought, what are the causes, what are the solutions? Is there a possibility of having a very smooth transition from 30s to 40s and then to 50s? So I would like to repeat myself. Education is the first step of self-care. As a women, we have to take care of ourselves. Not only for us, not only for the family, but for ourselves, for our loved ones. And for the same reason, today we have with us Dr. Dimple Jain. She's a senior gynecologist, expertise in high-risk pregnancies, laparoscopy surgery, and infertility. She comes with a wealth of experience. Like, she carries with her a wealth of experience of excellent academic career, and she's practicing from last 18 years. So who will be a better person to tell us about a transition from normal women to a menopause women, from a phase of 30s to 40s, from pregnancy to a menopause stage. So a very warm welcome, Dr. Jimple.
Thank you, Nisha, for this warm welcome and gratitude towards me. I am humbled, and today we will talk about menopause definitely,
Yes,
and we will definitely solve the queries of our viewers today.
definitely, ma'am. So, ma'am, I would like, ma'am, please just help us with what is menopause? What does that term mean?
So,
Menopause?
yeah, so menopause is a period where your menses ends. Okay, this is a transition phase. Like women are born with eggs. Okay, your ovaries are full with eggs. And as you grow in your 40s, your eggs are reduced in number, your ovaries make less estrogen, and that leads to your cessation of your menstrual period. And that is perimenopausal period. When it comes to an end for continuous 12 months period, cessation of your menstrual period for a continuous 12 months is termed as menopause.
Right.
Okay, so 1 year continuous you are not having menses will be considered as you have entered into menopause. And after that, your postmenopausal period starts. So perimenopausal period is very, very important because you will be having symptoms like hot flushes, night sweats, vaginal dryness, lack of sexual desires. All these symptoms will definitely trouble you.
Ma'am, how long does this perimenopause stays for?
Perimenopausal period differ from each in every female, it differs from for the numbers. Okay. In one female, it might end for 3 to 4 years, in other 5 to 6 years, or in some women, some happy women, nothing will happen to them. So it is a very, very important period in which you should know that what are hot flushes, how should you deal with them, what is vaginal dryness, what are the night sweats. Don't get panic.
Right.
Be happy. Be happy with the transition, because this menopausal period will be with you till the end of your life.
Right. So, ma'am, help me understanding what is the difference between perimenopause and premenopause, because these are the terms which
So,
were confusing even when I did the study.
yes, yes, yes. So perimenopausal period start from the 40s. Okay, so your ovary making gradually and gradually decrease in the function of ovary. So estrogen production is continuously going down. Okay, so you might have problem in menses like irregular periods. You might have heavy periods, or you might have frequent periods, or you might have amenorrhea for 2 or 3 months also,
Okay.
because your over formation is not happening, your estrogen production is getting decreased, and because of that, you because of less estrogen hormone, you might have feeling of vaginal dryness, hot flushes, night sweats, mood irritability. Like I am very much emotionally tortured. Okay, like feeling of depression, you might not having sleep properly, like insomnia. Okay, and not feeling good factor, like I am not enjoying my sexual life. Okay, so these are the perimenopausal symptoms. And slowly, when you will have continuous 12 month break of your menses, like 1 साल से मुझे periods नहीं आया है,
Right.
that is considered as you have entered into menopause.
So, ma'am, during the perimenopause phase, what are few such symptoms that a woman comes to know? Okay, now I'm nearing to my menopause. I need a expert guidance.
Okay, so first and foremost, they will have like, I am feeling very warm. Like the feeling of warmth may be like feeling of light warmth, or it may be so intense that you may just wake up in the night because of from your sound sleep that I am feeling very hot. Okay, you may have perspiration at that time also. Okay, or you may have perspiration, increased heart rate, not having sleep properly, or irritability of mood is very much important. Like everyone is, whatever normal things are looking like this is troubling me. Okay, and you are not enjoying your sexual life. Okay, but friends, sexual life is also very much important, because I know vaginal dryness will be there because of low estrogen level, but you should enjoy your sexual life to increase the vaginal blood flow. When you will have relation with your partner, it will improve your vaginal blood flow, and it will automatically decrease your vaginal dryness. Okay, and for hot flushes and night sweat, definitely if it is troubling you a lot, then definitely you should talk to your healthcare provider, or you should consult your gynecologist.
So, ma'am, as we are moving from a perimenopause stage to a menopause stage, you've already mentioned that there should be a 12-month no periods, right?
Yes,
But
right.
there are symptoms which continues from perimenopause to menopause stage as well. So, for example, hot flashes. So, what is the solution
Yeah.
for that? Is the medicine only solution for that, or is there any other solution?
No, it like you should change in your lifestyle modification should be there. Like you should start exercising daily. Exercise in the sense of meditation, daily yoga, or brisk morning walk.
Right.
Like you should enjoy the morning weather. Like you can't say like I am not able to get up at 6 o'clock in the morning. But boss, you can get up at 7 o'clock and you can enjoy brisk morning walk for 30 minutes in the early morning hours, or in the evening also you can do that. So lifestyle modification is very much required. Stay calm and cool. This is very natural physiological process of life in which you are entering, and you should enjoy it rather than making it anxious for you and your partner and your family because of your mood swings. Okay,
Right.
so for hot flushes, like in the diet you can improve your soya chunks. So in the diet you should have diet rich in isoflavones like soybean, lentils, chickpeas, fresh fruits, fresh vegetables. All these will help you in your transition phase.
So, ma'am, as we move on towards the menopause stage, which actually comes with a lot of stigma. So, it is a new line that gets most women apprehensive before even it is there. So, ma'am, just help me understand how our body works during menopause, because once we stop having our menstruation cycle, definitely there is a big change in our body.
Yeah, so big change in our body, like you will be relaxed, so you will be not having your monthly cycle. So that is a positive thought that you can think like, yeah, no tension now.
Right.
Okay, first, you should see everything positive in a negative aspect. Don't think that I entered into menopause. Think that you are enjoying the next page of the life. That is very much important aspect. Your perspective towards your new life journey. Okay, then that is very much important. You have to stay active, do regular exercise, drink a lot of fluids, drink lot of water like liquid juices, keep yourself hydrated, stay active. Stay active will keep you mentally and physically active and mentally happy. Okay, if you do regular exercise, that will keep you active and you will not forget things. Because in menopause period, there is a tendency that you forgetfulness increases. That is also quite common. Okay, so because it is in the menopause period, you can end it with the Alzheimer's disease also because of lack of sleep and because of lack of estrogen. And first and last but not the least, heart and bones. Lack of estrogen lead to osteoporosis, and there is increased risk of heart attacks, and there is risk of stroke also. So you have to take care of all the things: your heart, your bone, and your brain.
Right, right, ma'am. So, ma'am, also I read somewhere that once you enter the menopause stage, your reproductive cycles also get affected.
Sorry.
Ma'am, the reproductive cycle.
Yeah. Reproductive cycle. When you enter your menopause, your menses will not come definitely, and you will have less desire for having relationship with your partners. That is very quite physiological, but you should try from your end that it is a physiological aspect of my life, but definitely you should have sexual relations with your partner.
Okay. So, ma'am, as you said, estrogen and progesterone, they are like yin and yang of a female reproductive cycle. So, what
Yes.
role that they play and why their balance is important in our life?
Estrogen and progesterone are very much important hormone for our body. Estrogen is particularly important because first and foremost, the estrogen gives a strength to our pelvic floor muscles. Okay, and it increases the tone of your bladder also. So when you entered in your menopause, your pelvic floor muscle strength also decreases. Plus, it plays an important role in prevention of cardiovascular disease. Estrogen is a hormone which will affect your bone level. It will increase the bone formation. And if you are having less estrogen during your menopause, so you might have osteoporosis, or if it is not tackled at the proper time, it will lead to osteoporosis, osteopenia. Okay, these are the stages. Like 25% reduction in the bone mineral density happen when your estrogen hormone decreases. That's why we say like old age you are very prone to bone fractures.
Right.
That's why you always old females like walk slowly and take care of yourself so that you should not get fall, because if they will fall very slowly also, even if they can get fracture.
Right.
Like hairline fracture or Colles fracture of the bone. So bone fracture also very common in menopausal period
Okay, okay. So,
because of less estrogen.
less protein also. Also, ma'am, at this stage, like in perimenopause, we discussed about hot flashes, sexual desires, weight gain, and stress hormones, a very important thing. So, once
Yes.
you enter menopause, are these all symptoms gone or they continue?
When you enter into menopause is considered like 1 year, you have not get your menses. And
Right.
after completion of this, you enter into post-menopausal period, and all these symptoms ease to a little bit. Like your hot flushes will come to a decreased intensity level, night sweat will also decrease, but definitely in case you are having more problem, definitely you should talk to your healthcare provider, consult your gynecologist, do regular checkups, and don't shy to consult your gynecologist.
So, ma'am, is it possible to balance these hormones naturally?
So naturally, there are like naturally, so you can do lifestyle modification like food habits and exercise, and there are multiple supplements available in medical wise treatment which we provide according to a patient's requirement. There are non-hormonal therapy and hormonal therapy are available for this. So non-hormonal, we in India we normally prefer non-hormonal therapy. But yes, if patient is definitely requiring hormonal therapy, then we think about it for go it. Like estrogen supplement and estrogen plus progesterone. Estrogen supplements are available, like pills are available, rings are available, patches are available. We can try that. But
Any major
first and foremost,
pills and everything, ma'am?
sorry.
Any, any major side effect of these pills?
Yeah, the pills, you might get prone to cancer. That's why we avoid hormonal therapy.
Right.
Okay, like colorectal cancer or ovarian cancer. So first and foremost, we try to resolve the menopausal complaints by non-hormonal therapy.
Right. So, ma'am, what is the role that a menopause plays with the stress hormone?
So stress hormone is very much increased. Stress level is very much increased in menopausal period because there are definitely mood swings in this age group. Like they may have like behavior problem, irritability increases, depression increases, anxiety level increases, phobia part increases, and because they are having lack of sleep, all these further escalate your stress periods. And these symptoms like depression, anxiety, and insomnia and behavioral problems. All mood swings lead to these problems.
Right, right, ma'am. So, ma'am, as we move from a menopause stage to a post-menopause stage, which is like a new phase of our life, and it stays till the end of our life with us. So, how do a mother knows that, oh sorry, how do a woman knows that she has moved from a menopause stage and now she's in a post-menopause stage?
Yeah. So, like in perimenopausal period, you were having symptoms like hot flushes, night sweat, like not having a relationship with your partners, or life behavior problem. So these will come to a little low level of intensity.
Mm-hmm.
Okay. So, and you will definitely enjoy your postmenopausal period. Okay. So hot flush intensity will be decreased very much less. Your night sweat will be decreased, but definitely you should take care of your heart, your bones, and brain, like cardiovascular disease and osteoporosis and stroke. These are three important things which happen in postmenopausal period because of low level of estrogen hormone.
So, is there any symptom to really look forward that this is something which immediately needs a expert's advice or a medical help?
Like I am having very much too many patients of hot flushes because it's 75% female hot flushes definitely happen. Okay, so if it is troubling your life, if it is affecting your quality of life, then
Mm-hmm.
definitely you should seek your gynecologist or your healthcare provider's advice.
Right.
Definitely, and regular checkup is anyway which at most required nowadays.
Now, so we have also,
Yes.
while we was doing a study on this topic, I read lot many places. Even there are a lot of women who faces skin and nail issues, hair issues.
Yeah, because hair loss might be there because of lack of estrogen, like thinning of hair occur, thinning of hairs occur, thinning of nails occur.
Okay. So,
Okay, hair loss increases, and some women might get her chin hairs. Okay, there may be like very much density decreases, but but there are definitely thyroid also plays an important role. So you should get yourself checked for thyroid hormone also, that is known as TSH level.
So ma'am, this generally happens during menopause or post-menopause stage.
On post-menopause typically, like transition, menopause and post-menopausal period, definitely.
Right. So, ma'am, why postmenopause phase is very important? Because when we do a study, it's very small about premenopause, then very little about menopause. But there was a big thing to read about postmenopause. So, why that stage is
Post,
very important for?
yeah, post-menopausal period is very much important because that is the phase your age is increasing and you are prone to multiple type of diseases. Like you are prone to cancers also. That's why you have to be very proactive in this phase of life. Like if you are getting in postmenopausal, you might have complaint of postmenopausal bleeding also.
Oh,
Even if it is a single episode, definitely you should immediately consult your gynecologist. Don't think कि नहीं ऐसे ही आ गया हो. Okay, single episode of postmenopausal bleeding is also very important. Consult your gynecologist. Your gynecologist will tell you to get sonography done or to rule out any other if any cancer is developing. Because in postmenopausal bleeding, many of the patient just ignore कि नहीं ऐसे ही हो गया होगा, ऐसे ही periods ही आ गया है. So you should not do that. First and foremost, postmenopausal bleeding. Second, like there are medicines available, like vaginal creams are available, like estradiol cream and estrogen creams are available, which will improve your vaginal dryness level so that you will not have feeling of like atrophic vaginitis or vaginal dryness area, so that and you will not have having problem in intercourse. Like painful intercourse is also a very common complaint in during this period.
okay.
Plus, you should check your like bone mineral density should be checked. If it is really low, like calcium supplement, another vitamin D supplement is also very much required for this age group.
Right.
And heart oriented issue like ECG should be done. And regular checkup is very much required in this period.
So, ma'am, when you're saying regular checkups, so does it mean 3 months, 6 months? What time difference?
Like annual checkup should be there, like your breast examination should be there, okay, and like sonography you can do it, or blood investigation, like regular routine blood check should be done definitely.
So, ma'am, as we all know now about, we have discussed about perimenopause, we discussed about menopause, and now we discuss also about the postmenopause. Can you give us some tips for a healthy transition from one stage to another? So
Yeah,
from
so for tips,
age
like
till 30,
first and foremost,
for her, what is
yes, yes. So stay active, okay, stay active, do regular exercise, drink plenty of fluids, okay, be sexually active, but don't forget to use condoms because definitely you can't get pregnant, but you are prone to sexually transmitted diseases. Okay, so barrier contraceptives should be used. Okay, and you should take care of your blood level, like triglyceride level should not be high because HDL level should be good, LDL level should be low, and uh, prevent osteoporosis.
So I'm now from perimenopause to menopause.
Yeah, so perimenopause, the funda is clear. Like regular exercise is very much necessary to keep you mentally and physically active. Eating good good food habits is very much necessary. Okay, like good food habits, like no eating of pizza, burger, and all that stuff. Okay, and stay active, enjoy your sexual life, and stay away from the mental stress.
Right, that is very important. At all the
Yes.
whichever stage we
Yes.
now at, it's very important to follow all these things. Right.
Yes,
So
definitely.
when we were discussing and we're talking, there are a lot of questions that mothers have put up. So we'd like to take the first one. Of course, the answer, you have already answered this thing, but can a mother do high intensity exercise once she is in menopause or maybe post menopause stage?
Yes, they can do exercise high intensity, but it should be kept in mind that you are very much prone to fracture. It should not be like that while doing exercise you fallen down.
Right.
Okay, it should be a balanced one, and like slow and steady you have to go. Like on the very first day, you can't do very high intensity exercise. Like first you have to train your mind and body, then you have to go ahead.
Right, right. So moving on to the next one, ma'am. So this is mother. There's this woman wants to ask, will I experience the same symptom like my mom, sister, and friends?
No, no, it is not. It is not at all right. Every woman has different symptoms in their perimenopausal period, menopausal and postmenopausal period. So there are like some might have no symptoms, no night sweats, no hot flushes, no vaginal dryness, but some have so much intensity. Like one of my patient is having like she has to quit the job because of hot flushes and night sweats. Like it was so much intensity. But like, it all depends. Then they came to me like via referred from my one of my friends. They came to me. I prescribed them medication and all the other treatment, and now she has rejoined. So they were happy. So you were saying like at what stage we should seek the medical treatment. So yes, if it is troubling your life, quality of life, definitely you should meet your doctor.
Right, right. So ma'am, next one is what symptoms are caused by reduced level of estrogens?
Symptoms are like you may have fatigue, depression, crankiness, like your heart is beating fast, you are having headache, joint pain, muscle pain, यहाँ दर्द हो रहा है, वहाँ दर्द हो रहा है. These symptoms are other than your lack of sexual desire, hot flushes, night sweat, आपको रात में नींद नहीं आ रही है, mood swings काफी ज्यादा है, not feeling good at all, मुझे कुछ भी अच्छा नहीं लग रहा है. It's like that. Excuse me? Yes.
Yes, ma'am.
Can you hear me?
Yeah, ma'am, I can hear you.
Am I audible?
Now it's
Yes.
yeah, you're
Yes.
for a second.
Yeah, actually one call came there, so
Okay,
yeah,
not
definitely.
So moving on to the
So
next
sorry.
one. What are hot flushes and how long a woman can have them?
Like
So
it
as
depends. Period definitely depend. In some patient, 1 to 2 years. In some patient, it might run for 4 5 years also. So it is not like that. Ki, characterize that ki like only 1 year you will have this symptom or only 2 years. It may vary from 1 to 7 8 years also.
right. Ma'am, as we were discussing hot flashes, I'm sure आप तो जानते ही हो, मैंने भी पढ़ा होगा. There are some mothers who wants to know that what is the term hot flashes means. What does it mean when I'm
Like
saying?
hot flushes means hot means warm. Okay, so you feeling of warmth, like सब गरम गरम लग रहा है, मुझे कुछ अच्छा नहीं लग रहा है, like मेरी बॉडी गरम हो रही है. Okay, और इतना गरम हो जाता है कि like in the sound sleep also it can wake you up. So feeling of warmth is hot flushes, and to cut it down, stay in cool environment, drink cold water, okay, stay in the fan, or wear loose cotton clothes. Okay, so perspiration will not be there.
Right. So there's this one mother, she's asking, I never had any problem in my periods. It was always with a 28-day cycle. Is it possible to have a difficult menopause stage?
No, that we can't predict, but definitely it should not be there. Hope for the best that it will not be there, definitely. But it is not related to that, like 28-day cycle regular hai mera, and I am not having any heavy blood flow, no clots, so I will not having in transition any problem in transition phase. It is not like that. It all depends, like in your body physiology, how it is functioning at that level.
So, there's this mother, she's asking, I had PCOS. Will I face a difficult menopause?
No, as I said earlier also, it is not like that.
Not,
Like polycystic ovary की वजह से menopause में problem आएगा, it is not like that.
not connected, right? How do I know if my change in periods is simple perimenopause system or something else?
Look, like in perimenopausal period, you might have polymenorrhea. What is polymenorrhea? Like their frequency of periods have been increased. Like they are coming at like if you are getting a 28 days interval, They are now coming at every 15 to 20 days or every 10 to 12 days. That is first. Second is scanty periods. Like you are getting it every month, but it is scanty. Third is like having heavy blood flow during every cycle. Okay. But if it is troubling, like heavy blood flow is too much, like you are getting anemia or it is giving you trouble, like it is not stopping till 7 8 days, then definitely you should consult your doctor. So the complaint of menstrual period vary from one patient to another patient. Like you might have irregular periods, you might have no periods at all for 2 3 months. कि 2 3 months तक period नहीं आएगा, फिर period आएगा, then you will get. Or some might have menorrhagia complaint, like heavy menstrual.
So there's this women, ma'am, she wants to know what is the relation between menopause and weight gain.
Menopause and weight gain. Yeah, weight gain might happen, but definitely if you are active and doing regular exercise, it will not affect you.
Okay, so there's this one more.
Because what happened now, because of low estrogen hormone, your body weight around your waist increases. Like you may have like belly has increased. So these are also menopausal symptoms.
So normally women at 45, 40, 50, they start feeling that they're
Yeah. क्या मेरा पेट बढ़ गया है?
right. So that is not because of the diet, that can be because of the menopause stage also.
Because of menopause. Yes, yes. That's why exercise is very much important aspect of our life.
Right, right. So ma'am, as we always say, और आपने भी बोला कि menopause में medicines हैं, but once we reach the post-menopause stage, so what is the role that our diet plays there?
Diet may like you should actually there are researches are going on, like soya rich foods provide you isoflavones which help you in decreasing your menopausal symptoms and help you in smooth transition. Okay, so in diet you can have like soya chunks or lentils or chickpeas
Right.
or beans,
Right.
fresh fruits, fresh vegetables. So this diet are important in that.
Right. So ma'am, there is this woman, she wants to understand that once I stopped having periods for 12 months, and then again it started with a normal cycle. So
No, if you are having continuously cessation of your period for 12 months, they have not come, then you have entered into your menopause. But yes, after 12-month period, you again started bleeding, definitely you should consult a gynecologist, get sonography done, why it started. Like your endometrial thickness level you should know it, what is your endometrial thickness.
ma'am, what is
Because nowadays, the uterus, this is our uterus. Uterus के अंदर का lining होता है, that is known as endometrium. Once we entered in menopause period, it should be less than 4 millimeter. If it is more than 4 millimeter, definitely it should be ruled out what is going inside.
right? So ma'am, menopause also affects our hemoglobin levels?
Not really.
Not really.
Not
So I think we have covered all the questions. Would love to listen more, and if anyone has any questions, please feel free to share it with us. We'll take questions with ma'am. Ma'am, so you covered menopause, postmenopause, and perimenopause. You have said that the diet, exercise, regular checkups are very important, and the space is also very important. And whenever we
Yes.
stuck somewhere, or we're having something which is very painful, which is very awkward, which is very not regular things in our life, rather than ignoring them or making them as a part of life, we should always go and ask doctors. We should always go and take help from our experts. So as one incident, even I remember, there are a lot of, like, my mom is there, or maybe my elders are there. They always come running from their rooms, open the fridge, and they just forget what they have come. So is that also one of the menopause symptoms?
Yes. Black chocolate is very much good for isoflavones requirement. So
So there's something to them, because that is one thing that a lot of women faces, that they just turn around in the kitchen and they're like, bye, and आप भूल जाते हो. So is that a part of menopause? Sorry, I'll repeat myself. So there are a lot of women at the stage of like 40, 42, 45. They always complain, भूल जाते हैं. Suddenly you feel that, okay, ये करना था, and the moment you reaches there, it's all blank. So,
Yes,
because
so
of
that is insomnia. Yes, that is insomnia, that is forgetfulness, and that is only because of menopause. Okay, and that is hormonal problem. Like your estrogen level are decreased. Okay, so your brain is acting little less. Okay,
right.
so that's why forgetfulness is very much common during menopause period. This is very common feature. That's why I'm emphasizing on stay active physically. That will improve your mental activity.
Right.
Understood? Now play Sudoku. Cut down your TV time. Okay. Play new games. So your brain gray matter will be active. Okay.
Right.
That is quite physiological and that is really a menopausal symptom. And it is not like that your buddha or is menopause symptoms of this.
We should also enjoy the menopause symptoms. We're doing something which is only around us, for us, spending some good quality time with ourselves, right?
Yes, that's why your social life should be good in this period. Okay, you should have good friends. With them, you laugh, you enjoy, and you should share your thoughts which are troubling you.
Yes, definitely, definitely, ma'am. So thank you so much, ma'am, for taking us through such an important phase of a women's life. Like not only a pregnancy can be a 9 month stage, it comes and then you are again free of that. Then you get into a new pregnancy, then again new symptoms. With menopause is something, once it starts, it stays with us lifelong. And coming
Yes,
from you, a guidance, the words, definitely that makes a difference, and it gives all the women more knowledge about the topic. And I'm sure all people who are watching our show today, they must be very thankful that you have shared everything in such a simple way that we can understand and we can follow. And definitely, if there is any more questions that you all have, mommies, please do share with us. We'll try and connect you all with Dr. Dimple Jain soon. So, ma'am, thank
thank you very
you
much,
so
Nisha,
much, ma'am, for
for
taking
conducting a successful session.
Thank you so much, ma'am. Bye, ma'am.
Uh,
Thank you, mom,
Bye.
for joining us. Take care. See you all soon.
Thank you, everyone.
Bye, ma'am.
Bye.